So today's COVID cases, we've reported that there's 8,881 new cases. What we've seen in the past week is a 15% increase in the number of COVID cases being reported. We know the majority of these cases are people who are doing home rapid antigen tests, and we thank them for continuing to do these tests and to register these tests so we can keep track of the number of cases we do have in the community. We are seeing more of the new BA.2 variant. When I say the new one, I do want to acknowledge our amazing forensic team who identified this new variant back in December and shared that information internationally, and we are now seeing this new variant across many, many countries. But it is a timely reminder with cases going up again that people need to go get vaccinated. Now, I'm very pleased with our adult vaccination rates. We are now at 93.28%. Our first doses are 91.49%. They continue to gradually go up, and I am confident that we can get to 95% and beyond with our adult population. But we know that almost 40% of eligible people who are due for their boosters have not got boosted yet. So I strongly encourage people who are due for their boosters to come forward and get that vaccination. They can do it at pharmacies and GPs now, readily available. There's multiple different vaccines available for boosters. And we do say to people there is no point in delaying this. We know that so many people are getting COVID, and we know that the majority of people, especially who have had their booster, are not becoming seriously unwell. And I'm very pleased that, having had the booster myself and recently got COVID, I had very mild symptoms. So I do want to encourage people to go get their booster. But I also want to message parents out there. Our 5 to 11-year-old vaccination rates are only at 43.15%. We need these rates to be higher. We know the majority of young children are not going to get seriously ill, but we have a vaccine there. And why take the risk that your child could be that one that ends up needing hospitalisation? And we are seeing with BA.2 that it's more of the young people getting this, right from primary age up to 30-year-olds who are getting BA.2 variant. And it is highly contagious. So I just remind people, it's still a contagious disease. It is still transmitted very easily and quickly through the community. And sadly, some people are needing hospitalisation and ending up in ICU. And as we keep reporting each day, people are still losing their lives who are COVID positive. So please come out and get vaccinated. The virus has not disappeared from our community. I know we've been dealing with so many things in our community in recent times, including the floods. But please remember that the virus is there. It's as dangerous as it's always been. And there's something that you can do to help reduce that risk, and that is get yourself vaccinated, whether it's your first, second or your booster shot, and also getting your children vaccinated. I'll now hand over to the Chief Health Officer to just give a bit more information about what we are seeing with this variant of BA.2. Thanks.
Thank you very much, Minister. Throughout the pandemic, we have been closely monitoring variants of the virus to ensure that we have an appropriate response to the pandemic. We have always known that the virus will change, it will mutate, and with that, case numbers will wax and wane, and we've always expected that. In December of last year, Queensland Health identified a subvariant of the Omicron strain of COVID-19, now known as BA.2, in an overseas traveller, and alerted the international community to that subvariant at the time. That strain has now been reported in more than 90 countries. It's a bit more transmissible than BA.1, the initial version of Omicron, and it's fast becoming the dominant strain of the virus, both here in Australia, including Queensland, and worldwide. Now, prior to March, there had only been a small number of cases of BA.2 in Queensland, but in the last 2 weeks we have seen 58% of the viruses sequenced in Queensland identified as BA.2, and it is likely that this virus, we effectively the only, or practically the only strain of the virus we see in Queensland and the rest of Australia in the coming weeks. So I think we're going to be, it will be by far and away the dominant strain of the virus in Australia within weeks. There has also been an increase in the number of COVID-19 clinical cases associated with the emergence of this strain in Queensland, just particularly over the last 1 to 2 weeks. And this pattern is being seen right across the country simultaneously, and in fact right across the world. The increase has occurred across all age groups, but particularly in the young, from preschool children to the age of about 30 is dominant. And this just reflects the social activity of this age group. Cases have increased by 15% in Queensland over the past week. But to put that in some context, in January, when we saw the peak Omicron wave, we had a doubling of cases every 2 to 3 days. So a 15% increase is certainly significant, but it's not nearly of the same magnitude of what we saw in January. So the other good news so far is that vaccination continues to protect against severe disease, and so far there has been no effect on hospitalisations, although it is early, and I think we can reasonably expect that hospitalisation numbers will increase in the coming days and weeks. So at present we still just have 233 people in public hospitals with a diagnosis of COVID-19, which is a very small number, and just 8 in the intensive care units, which is including 4 ventilated. But I would point out that this BA.2 wave is probably only 1 or 2 weeks it's running for only 1 or 2 weeks in Queensland. So we do expect to see an increase in numbers, the magnitude of which it's not really clear at this stage. And in terms of children, there are still only 19 school-aged children in hospital. This hasn't changed since this wave has begun, but again, it is early. So again, I'd remind everybody that vaccine boosters are particularly important in adults to protect you against the more severe disease. We notice that young adults are probably not getting their boosters. Older adults seem to be getting them, but younger adults, if you don't want to get sick with this virus, get that 3rd dose. It really makes a difference. And our vaccination rates in children are lower than we would like. And although I fully accept that COVID-19 in children is for the most part a mild disease, I'm not trying to frighten parents here. So for the most case, we all know it's a mild disease, but there are a number of reasons why you should get your primary school child and secondary school child vaccinated. We can see serious complications with COVID-19 in children. There's a complication called multi-system inflammatory syndrome, and we have seen quite a number of cases of that in Queensland in the last few weeks. So it's there. It does happen. It's not a myth. We are seeing children with this serious complication, including some who have gone to intensive care. No deaths, thank goodness, but we've had some quite seriously ill children. And long COVID is seen in children, and we know that vaccines protect against long COVID. COVID is disruptive to a child's education. COVID can cause severe illness in children with other underlying medical disorders, and of course COVID can spread from children to family and friends. So we will continue to monitor the situation, but we do not plan to introduce any new public health measures or reintroduce any new public health measures to deal with this current BA.2 wave until we get a better sense of what it's like. But at present there are no plans to introduce any additional public health measures. But I would just remind everyone, people should feel very comfortable to wear a mask if they want to in crowded environments if they wish. including school children. If they want to wear a mask at school, they should feel comfortable wearing it. But we're not going to be mandating anything like that at this stage.
Just noting that children in hospital,
yes.
It's a tricky line to navigate the border between picking up the week last week about the mental health impacts on kids and the actual threat to their physical health. Is that really tricky to manage?
Absolutely, absolutely, and that's why I do not think we need to be imposing any new restrictions at the moment. A legal restriction from the chief health officer is a very serious thing to undertake, and I will only undertake that if it is clear that there is immediate threat to the safety of Queenslanders. And that's, for example, why we issued mandates to do with masks at the beginning of the Omicron wave, where there really was a clear and present danger to Queensland. At this stage, that does not exist. We will continue to monitor the situation, but we will not use the instrument of the Chief Health Officer mandate at this stage for it, just on the basis of what we're seeing, because this is likely to keep going. This is going to be the pattern probably for months or even years, where new variants emerge, minor mutations occur, and cases wax and wane. And it's my job to monitor what the effect of that is, particularly on hospitalisations. And we are really mostly interested in severe disease. And severe disease, if I can remind everybody, severe disease means that you need to be hospitalised. Now, that doesn't mean that it's not nasty. So COVID-19 can make you sick and can give you an illness with a fever and a headache and put you in bed. But severe disease is where you get hospitalised, and that's mostly what we're monitoring. At this stage, we're not seeing significant numbers in increase in hospitalisation or increases in intensive care admissions. And I've been talking to my counterpart in New South Wales, Kerry Chant, and as of yesterday, they're about a week or two ahead of us. They have not yet seen significant numbers of or intensive care admissions in New South Wales yet, but we're monitoring the situation. We don't have good modelling on hospitalisations yet. I think we need more information about this variant, but we're working on that. They may well stay there for months, and that's across across Queensland. That is not a big number. In my mind, I think we will have a COVID ward in most of our big hospitals for certainly some months. And if we can keep COVID cases to one ward per major hospital, that is very manageable for a hospital. When we start to get 2-3 wards full of COVID patients, that's when things start to get difficult for hospitals. So if we can keep that, and 200 is certainly less than one ward per major hospital in Queensland. I think every school needs to look at their own situation. So if they're in a boarding school, for example, or if there are large numbers of cases in a particular class, I think that's a fine idea, and they should be encouraged to do that. I'm just not going to mandate it for schools, legally mandate it. So it's quite acceptable, and I think they should feel very comfortable doing that. For my understanding and from my paediatric colleagues is that for little children, vaccinating in schools without the parents being present is not a good idea. You want the parents to be present, particularly for primary school children. So I'll just say that's probably the only thing I'd comment about that. So I think the system we have is more than adequate for dealing with small children, and it's probably better for them to go to their GP or pharmacy with their parents. There's active discussions around all the mandates every day, I can say that.
No, so we lift the suspension on elective surgery in March. We're very pleased to do that. In fact, some hospitals were able to do that even earlier at a local level. So we are moving back to the planned care. Of course, that is being staggered based on prioritising those most urgent, and it will take some time to catch up on all of that suspended elective surgery. But no, we have no intentions based on the current level of hospitalisation and those in ICU to suspend elective surgery as a statewide initiative at the current time. Okay. Oh, look, I think it's important to continue to review legislation and make sure that it's meeting expectations. But as far as the RTI and the Palaszczuk government, I'm surprised that the LNP would be calling for a review or criticising, because we've reduced the cost. I think it was 27 cents a page under the LNP when they were in government. It's down to 15 cents under the Palaszczuk government. And we've got a higher percentage of documents that are being released each year. So our record stands strong compared to the LNP, where we've got more documents, providing more transparency at a lower cost. Well, as I say, the figures I've seen per page is less than what it was when the LNP were in government. I'm not sure of the application fee, but these applications, and I know in health, there's a lot of work that goes into providing those documents. Sometimes the queries are quite complex, including the ones that the media ask, that could go on to hundreds of pages, if not more. And so obviously that comes at a cost and resources for, government agencies. It's only fair that those costs are recouped. But what is important is that we are releasing a substantive amount of documents every single year, and we're very proud of that. So Brittany and I will be catching up in person next sitting week, but I spoke to Brittany on the phone today about those services. Look, what I expressed to Brittany is that I want to see more termination of pregnancy services across the state, not just in central Queensland, but across the state. Now, whether that is being delivered at our public hospitals by Hospital and Health Services or by a private provider, I am open to looking at any option, because simply decriminalising terminations is not enough. We've got to make them accessible for those women who seek to exercise their rights on their bodies in relation to terminations. And I want to make sure they're getting the support that they need to do that, so that they know that they've got options, that termination isn't the only option available to them, that there are other supports there. And we know that we are seeing a number of women accessing other treatments now, so they don't need surgical terminations through their GPs and through pharmacies, and that's a good thing, that women feel like they can access those services. So I'll continue to work with the Department of Health and our Hospital and Health Services to see where we can establish these services and whether there are other private providers who are willing to step in and to provide these services in the regions, because it's not okay to predominantly only offer these in southeast Queensland. Yeah, look, it is promising. I think the number of people that are registering their positive rapid antigen tests says that the public are doing the right thing, that they know the importance of not just doing a test, but registering that test and also isolating and quarantining. And, I know it's a challenge, having just gone through it. My daughter got it first and then I got it, and my son's very, very happy he managed to escape it, but he still had to do 9 days at home because I tested a couple of days later positive. So, it is a challenge for families, and I get that. The number of colleagues who I know who have recently been positive have all got it off their children, have all contracted it off their children. So we do need to emphasise it's important that kids get vaccinated as well, because it can reduce the risk of them getting infected in the first place. It can reduce the risk of transmission, and all of that helps our community, because it's not just about how healthy our kids are. There are other kids and adults in our community that are extremely vulnerable, and whether they're vulnerable because of age or whether they have other underlying health conditions. And I recently, on International Women's Day, went to an event where one of our strong women advocates around disabilities spoke. And she said, what about us? We feel very vulnerable. We feel like we can't go out and enjoy life because the virus is spreading. So we owe it to everybody in our community, not just ourselves, to get vaccinated, to do what we can to protect them as well.
I mean, why has it happened now as opposed to earlier on? Is that the question you're asking? Why the 50% right now? It's a good question. I mean, part of it, I think, is that we've got a bit more relaxed. Is that necessarily a bad thing? No, I don't think it is. So we're not wearing masks, we're socialising more, so there is more opportunity for the virus to spread. And that has to happen at some point, as long as it doesn't get out of control to the point where the hospitals are being overwhelmed. So if we're getting a significant number of people with a relatively mild viral illness, that in and of itself is not a bad thing. It's only if we start to see a lot of serious illness leading to hospitalisation and a strain on the hospital system.
Yeah.
In terms of location?
Yeah, like, you know, say, like, there's a lot of
Oh, I didn't